This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome everyone. We are going to have a special episode today, and I'm honored to have the guest of today's episode. He is Professor of Physical Activity and Health in the University of Southern Queensland. He has written numerous books related to psychology and mental health of physical activity and sedentary behavior. He has published hundreds of scientific articles and been cited over 40,000 times. He is the first ever guest to be visiting for the second time in this podcast, and his episode has been the most listened episode. Ladies and gentlemen, please welcome our guest, Professor Stuart Biddle. Welcome, Stuart.
Oh, thanks, Ollie. It's great to be back a second time. I could make a joke and say perhaps they didn't understand me the first time, but I'm sure we'll have a good second discussion on your excellent podcast. Thanks for the invitation.
Yeah, thanks a lot for taking time in these special times. So 2 weeks ago we had a plan to discuss about mental health and career development, but we didn't know much. Just in mere 2 weeks, world has changed drastically. After that, more than 200,000 people have been infected by coronavirus, and more than 8,000 have died to it globally. More than 50 countries have closed their borders. Several countries are in a lockdown, and most countries are advising for so-called social distancing. 119 countries have closed schools, and over 850 million children are affected. As a psychology expert, what are your thoughts of the situation?
Yes, indeed, Ollie. It's a drastic situation, and even though I'm in my mid-60s now, this is something I've never experienced in my lifetime. And I think we can probably take two major issues here that we might want to discuss. And before I perhaps suggest what those two are, I should say that obviously my expertise is in physical activity and health and mental health, rather than too many issues around infectious diseases. So I think the context that we're in, which is the important thing, and how we can understand that, and how we can perhaps change one or two aspects of our environment to make things a little bit better, is what I'll focus on. So the two issues for me, one is the wider sort of mental health issues around changing social circumstances. So, for example, being at home working, or just being at home much more, that in itself is an issue. And then, of course, secondly, how about physical activity? How about sedentary behavior in our new environmental context? So those would be, and of course the two are related. So perhaps those are the two issues that I think we might have a discussion on, but I'm happy to go in other directions, of course.
I think those are really, really interesting. Like many countries have closed all sport and exercise facilities. People don't commute anymore to workplaces, and they're at home. How do you see the routines in daily life, but also in physical activity and sedentary behavior being affected?
Yes, that's right. I think, first of all, if we take the one situation where people are being either required or strongly advised and guided to work more from home, and let me be the first to say I know not everybody can do that, but for those who are required to work much more at home, you have got this changing situation where either people are out of routine, or they don't know how to set up a routine, or how to go about their work. And there's been a lot written on this recently, and there will be a lot of individual differences. So, for example, I've always worked a fair bit from home, not all the time, of course, and I found it a really good environment. I've set up my office in my house. I'm fortunate enough to be able to do that. And I find myself being pretty productive when I work from home, and I've done that for 40 years. But I appreciate that working five days a week at least from home presents more challenges. So I think a routine is one, like getting up, going to work. Well, where am I going to work? Well, I'm going to work in my house, but I'm still going to work. And then I finish work, and I stop work and sort of, go home. Well, actually, I don't go home because I'm already home. But so there's a routine that I think is really important. And I've actually got a colleague who much prefers to get dressed in work clothes, even though she works from home. And that's an interesting one, because she's psychologically then prepared to start and then presumably to finish work in a good sort of routinized way. So I think that's quite an important point to make as a starter.
Yeah. So you're saying that you should still have some kind of strong routine. How do you start the work and how do you stop the work? And I think the dressing up is interesting. I think there's some studies showing that, for example, when normal people put on a medical professional's white jacket, they start to pay more attention in detail and they get better scores in some tests. So I think how we dress up affects how we feel about ourselves and how we think about.
Yeah. I mean, that's absolutely right. Of course, there'll be individual differences. And I actually, looking back on my career, it's quite funny how I've changed my sort of preferences for dressing up, and they partly reflect styles and norms at the time. I mean, I remember being quite horrified when I saw males no longer wearing ties, but having an open neck shirt. This came in 10 years or so ago, became quite fashionable, and now it's the norm. And why I thought that at the time, I don't know. But so we go through phases. But I think this idea of either dressing appropriately or certainly getting a routine that you're now in your office, if that's what you do from home, and that is work time. That's very, very important, I think. Yeah.
And how do you see then the physical activity and sedentary behavior routines? I was talking with some people before, and they said that they are actually more inactive when they are at home, because in the offices where they work or premises, they need to walk for the lunch, they need to walk to different offices, walk to meeting, but at home they are kind of stuck. How do you see it personally? How do you see it from the science point of view?
Yes, I agree with that. I mean, whilst I may not have hard and fast evidence, I think what you've said is absolutely right. It makes good sense that when you're in an office, let's take a university academic, for example, as I am, then yes, you've described it perfectly. And in fact, I actually actively commute to work anyway. I walk. There's a short hilly walk for me, or there's a longer, flatter cycle route, and I alternate these. So if I don't go into my office, I immediately lose 40 minutes of that physical activity. So it's quite interesting from that point of view. And I think from the home environment, we are generally more sedentary. We're unlikely to have facilities that allow us to, for example, have a sit-to-stand desk, or we might not even have thought about it. And obviously, we won't have much in the way of exercise facilities. So I think we need to be a bit more creative. And under the current circumstances, we need to be planning much more for these activity breaks. So let me just say something about that in a general sense. Then we can perhaps pick that up in more detail. So I think it's worth mentioning that you could do your physical activity and exercise in several different ways. The traditional way, of course, is to set aside half an hour or 40 minutes and do something reasonably continuous. That might, of course, involve walking or running outside. And my understanding that is still safe to do as long as you're not next to other people. So that's one alternative, and it's probably not a bad idea to get out of the house if at all possible for mental health reasons. The second one might be to say, well, look, I've got this work environment at home. I'm quite sedentary. How do I break that up in small but regular ways? And there are two ways you can do that. First of all, you can create some kind of standing work environment. And if you haven't got a desk that allows that, then there might be something else. So I can see in my home office here, I've got an elevated filing cabinet, which I can stand at. It's not perfect. It's not quite at the right height, but it allows me to stand and maybe check some papers or look at the iPad or something like that. Or I can walk into my kitchen area, and I've got this elevated partition, which is like an elevated shelf. And actually, it's the perfect height for me to be working on my laptop and reading papers and so on. And actually, we have a standing desk upstairs anyway. So I think there are ways of having low cost, ad hoc ways of breaking up your sitting to carry on working, but in a standing position. And then the final one, so you got the prolonged exercise, that's fine. You got the breaking up of sitting, that's fine. But then a kind of hybrid of that is to say, could I break up my sitting and do a little bit of exercise at the same time? So it's not too disruptive to my work, but I get a little bit more intensity and a little bit more stimulation to the body. And one way to do that is let's say every half an hour, your phone reminds you that you need to do something. And it might be for a minute, it might be for less, it might be for more. And it might be just simple exercises on the floor, sit-ups, press-ups, stretches, yoga exercises, and what have you. And I've been doing that, and I find that quite an effective way. And you can accumulate, 8 to 15 bouts of these exercises relatively easily in the day, depending how quickly you set the reminders. So I think those alternatives need to be thought of. It doesn't have to be a fancy homemade gym that allows you to do these things.
So you could actually see this as a good opportunity, as there are not other people, colleagues seeing you doing. There's no norms. You have more freedom to do so. Would you suggest this kind of combining the breaks and kind of small exercise session for most of the people?
Yeah, I think you've got to go with what people are comfortable with and what they prefer and what suits their circumstances. For example, if a family has young children and they're finding this quite a difficult situation with too much time in the house altogether, then a bit of fun exercise as a family would be great. But of course, you don't want to make that an hour-long session where the kids get bored. So you might want to do a little bit of 10, 15 minutes of dancing and then move on to something else. So I think it's very much individualized to personal preferences and personal circumstances. I really don't like to be too prescriptive when it comes to the types of physical activity that you do.
Yeah, and actually the family and kids is quite important question at the moment, as more than 120 countries have closed the schools, and many of them have closed the kindergartens also, and you're not allowed to. It's not advised to have the grandparents taking care, as they are in the risk group. So many people there will be. Yeah, please go on.
Yeah, no, that's right. You're absolutely right, Ollie. And I have read some work where, just some comments on social media and so on, where sometimes we can underestimate how difficult it is for some families to do some of these behaviors. So, it's probably easy for me to say, oh yeah, you can set up a gym in your house, you can do this, you can do that, and then somebody comes back and says, hang on a minute, I don't have the resources. I've got 4 children running around my feet driving me crazy. I've got no other help. What do I do? And whilst I'm saying whilst I'm not saying that they can't do anything, I think we have to be very mindful that some people are in more difficult circumstances than others. Having said that, I'm sure it would be good for all of us mentally and physically to take a break from the stresses and strains right now and the routines and say, come on, let's have a bit of physical activity. Let's be crazy. Let's do a dance. Let's make ourselves look silly. And and I think most people would go for that. But I'd hate to be too prescriptive on this, as I say.
Yeah, no, I fully agree with that. So what would be your practical tip? Like, this is a new situation. How do you make a new routine like this? What are the steps?
Yeah, so this is a good question. So we're talking about a new context. And so we're probably not used to being in the house as much as we are. And therefore, we're not used to fitting in, let's say, bouts of physical activity or bouts of exercise. So you're absolutely right. How do we create that routine, and how do we create what we might call a habit? And habits actually are typically developed when we get an environment or a situation that triggers us doing something, and that's why if you walk into your building at work and it has a lift or an elevator, and you don't see the stairs anywhere, and you just get into the elevator and up you go, that becomes routinized and it becomes habitual. And for a lot of people, they walk into the building and they don't say to themselves, now then, where are the stairs? Where's the elevator? Which one shall I use? They don't go through all that thinking process because they've already routinized it, unfortunately, in that case. I mean, if they did the same for the stairs and they climb the stairs every day, as I do, of course, then the habit has worked in our favor. But that's my job to make sure I do these things. So fortunately in that occasion, I've chosen the healthy option. I'm sure there are other habits that I've got in my life that are maybe not so healthy. So the first thing then is to get to recognize the environment that you're in and try to make it work in your favor. So one thing you might do is to say, well, how do I prompt myself to get into a habit of doing some exercises? Well, if you've got a little yoga mat or you've got a towel that you can put on the floor that makes it a bit more comfortable to lie on to do some exercises, then make sure that's there and available. And you don't have to go and dig it out of a cupboard every time you want to do something. Make sure you've got a bit of music available that you like to listen to when you do exercise, and it's very easy to flick it on and off you go with your bit of exercise. You need something perhaps on your phone to prompt you to do something. And so all these sort of prompts, these environmental cues that you've got, start to create a little bit of a routine. And if it's done often enough, it's a little bit of a habit. Habits themselves are quite tough to create in the true sense if they involve a lot of physical effort. But we're moving towards that by doing these different things. And the final bit I'll say now, and then we can discuss it more if you like, is if these behaviors, doing those exercises, doing the dancing with your kids or whatever, is reinforcing and is pleasurable, and I say pleasurable in the sort of wider sense, it makes you feel good. Maybe it's even socially reinforcing. You're doing something together, then that also helps. It reinforces it, and you want to come back for more, to put it simply. So I think all of those things could be made practical and helpful to people to get into a little bit more of a routine.
Yeah, those are really good tips. So basically creating all kind of prompts in your house that will remind you of doing activity, which can be
Yeah.
visual, which can be music, which can be alarms, many kind of things. And how is it you said that it's pleasurable or it's social? Now it's difficult it to be social because most of the sport facilities are closed. You shouldn't be meeting people when you're outside. You should keep the distance of 2 meters. So a lot of the social element has been now removed from people's exercise and physical activity routines. How do you see this social challenge?
Yes, that's right. It has. Although I think there are at least two ways we could think of that. One is that you can still be social within the house by doing things. Families are going to be together in the house. I mean, unless there's some drastic, problem with the virus for one person who has to be isolated. But at the moment, if we're keeping our distance to prevent getting the virus, then we're in a social context within the house, and we can be socially reinforcing in that way, and do the exercises together. So there's an app I've used on my phone. I won't say what it is because it's not a perfect app, but there are many apps out there that prompt you to do certain exercises at certain times in the day. So mine prompts me every hour. I'd actually like it to be a little bit more often than that, but I can't seem to change it. Now, when I do that and I've done that in work as well prior to the coronavirus situation, we did that in work and I've done it at home. And it's often quite a good social thing to do because, you're doing the exercises together and it's a kind of little bit of a laugh to do it together. So that's one social thing. So the fact that you can't go to your local sports club is disappointing, but you can still be social in the house. The other one is you could, and I've seen this being offered now, is sort of more online social connectedness with exercise. So people will offer online leadership, basically a video, I guess, that you can join in, and it's a virtual exercise class. And when you think back to social contact in its widest sense, when I was a student in the United States back in the 1970s, I had no way of electronically communicating with my parents back in the UK. Of course, I could pick up a phone, but it was too expensive. So I used to write letters. And of course, now we have the wonderful advantage of online communication through Skype and WhatsApp and all these different interfaces. So maybe we can use those to our advantage, to be socially connected without being physically close to somebody, and maybe even using them for physical activity situations where exercise leaders set something up and you can join in. So maybe a bit of creative thinking, we can do something there.
Yeah, I fully agree. And you said about the app that you are actually exercising together. Could you clarify a little bit more how it works?
Yeah, it's extremely simple, and I think it could be improved, to be honest. But you set it off. You set it off first thing in the morning if that's what you want to do, and then every hour it prompts you to do an exercise, and you can then track your number of exercises you've done throughout the day, week, and month. It's extremely basic. And there are lots of problems, but little things that I'd like to change. But essentially, it's prompting me every hour to, get up if I'm sitting to do something. And they have nice diagrams actually of the exercises. So that's fine. Absolutely no problem with that. I think we could probably make a better one, and there probably are better ones out there. But and I quite like that if I'm at home and I sometimes feel I'm getting into a bit of a rut. With too much sitting, not enough moving and standing.
Yeah, I actually know also one app where you kind of do in a work community, you do the exercises at the same time. If you're in the same location, you actually do it in the same room, but you can do it in distance also. That
Yeah.
it includes like 3 exercises. You do 1 minute of each, and if you're doing in distance, you still see that now some person logged in. You see the name, and then you kind of can feel that we are still doing this together. That we are still
Yeah. Yeah.
acting, even though you cannot see or talk in that app. But I think
Yeah.
it's really interesting.
Yeah,
And
and
and I
I think that. Sorry, Ollie, you finished. Sorry, I
please go.
interrupted.
No, please go.
Well, I was thinking that that this. First of all, we're in exceptional times, and so I think we need to be creative, and we need to be accepting that there are lots of different ways we could try to get physical activity into our day, and so on. That said, I think not everybody will like every alternative that's offered to them, and I think we need to be sympathetic with that, and just try and steer them towards alternatives that they could choose from. And for example, I actually quite like doing yoga exercises in my house with another app that talks me through the yoga exercises. It's very nice. It's got nice background music, and it's very professionally done. That may not suit everybody else, but it suits me very nicely. So I think it's horses for courses, as we say, trying to fit it into people's preferences, but give them a menu of options, and hopefully they can choose something that they like.
Yeah, and I think even though this is difficult times, I think it's also a big opportunity as the technology is there, the video calls are, the apps, the technology is there, but I think now we are forced to use it, whether it's having the meetings from distance or actually doing exercise things. So I think there's a big chance. How do you see, how will the culture be different in 2 months, 6 months? I don't know when this is going to end, but after this.
Yeah, that's a very interesting question, isn't it? I guess none of us really know the answer, but yeah, we are being, well, first of all, we do have the advantage of technology that we didn't have in previous generations. And so the physical social isolation can be somewhat alleviated by online communication. We can do more work from home for certain jobs, at least. I can do pretty much all my work from home at the moment. And we have these options of being prompted by technology to be physically active, or relaxation videos and apps and what have you. So there are lots of alternatives that we can use. So we're very fortunate in that regard. Whether people will continue to use these in the months ahead after the virus has subsided, who knows? We do know in behavior change research that a lot of changes that people make to the behavior are relatively short-lived, and people bounce back to their old habits. But we'll see. But certainly we've got good opportunities right now to at least help in a small way.
Yeah.
Let's have a short break and hear a few words from our sponsor.
This podcast is sponsored by Fibion. Fibion is an accurate sitting and physical activity tracking device and analysis platform. It is a great tool for projects that aim for behaviour change in sedentary behaviour and incidental physical activity. Fibion provides easy-to-understand PDF and web browser reports for participants. Other features include comparisons to recommendations, linking results to health risks, achievement cards, and interactive goal-setting tool. In addition, Fibion provides an API that allows for easy integration to other systems and applications. Learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
So with all these changes now happening, how do you see the people's mental health will be during these special times?
Yeah, I guess the key issues will be around, first of all, anxiety around the virus itself. Anxiety either about their own health or other people's health. That's fairly obvious. And then I think in terms of the change social context of staying at home or trying to work from home or whatever they have will be around some social issues, maybe social isolation, less social contact, and maybe similar to what we were discussing earlier about fitting in physical activity is the danger of a lack of variety throughout the day and monotony and trying to avoid a sort of monotonous day. So I think those are the kind of key dangers, I guess, for mental health at this stage.
Yeah, how do you see the term? I think the term used is social distancing. Do you think it's the right term? Some people have suggested that it's spatial distancing or physical distancing. Do you think we have chosen in a hurry a wrong term that will give a wrong message to people?
Yes, we probably have actually. I mean, as I understand it, and as I say, I'm not the expert on viruses, but I think we all understand that it's the physical distance that is what we're encouraging ourselves and others to do. Yeah, I mean, okay, does it matter? It might not, but I think, yeah, physical distancing is really what we should be encouraging. And the social distancing is probably in the true sense, in other words, stay away from people socially is probably not what we're saying. We're saying that people should be socially connected, but physically a bit more separated. And of course, social connectedness is such an important area of mental health.
Yeah, and I think when you said that, does it matter? I think in the terms we use, they always matter on some extent. Do you agree?
Yes, of course, because otherwise things get completely misconstrued and people do the wrong things. The optimist in me says that people, I think, understand that social distancing means keep that 1.5 to 2 meters apart to prevent or to reduce the chance of infection. So, yeah, it's a good point you raise, and I do agree with you. It's probably not the best way we could have explained it.
And yeah, it's maybe 1.5, 2 meters that you should keep the distance, and I think there's less risk being outside. You don't have as many surfaces that you touch, so maybe this is time to meet people outdoors, keeping the distance.
Yeah. That's absolutely right. Yes.
Yeah, and if we think the situation in some countries which are worst affected at the moment, I think Italy, Spain, France, that they actually have, to my understanding, they have a lockdown that people need to stay at home. You are not even allowed to go for a walk. You can go to buy groceries, but you are not allowed to go to walk. And in some countries, they are giving even fines if you don't have a reason. How do you see the situation? Many cities are big, probably small apartments, the whole family stuck in the same place. And how do you see the situation?
Yeah, that is very challenging. There's no doubt about it. And no doubt people listening to this podcast will have seen some social media clips of some very, well, I was going to say innovative. Actually, they're not really that innovative, but they're rather heartening clips of how people in apartment blocks have tried to create something a little bit more positive, like mass exercise sessions led by somebody, 50 meters away on another rooftop or something. And another one was, where they were playing like a tennis or badminton back and forth across balconies, and so and somebody actually even put oil onto the floor of the kitchen so they could slide like being on a treadmill. is quite innovative. I mean, I'm not sure I don't want to do 20 minutes of sliding, but they're trying to think of ways of really being physically active, yes, but also being socially a bit more connected. But yeah, these are definitely challenges, and that's why I think the whole physical activity thing might be something that we need to think much more seriously about because of the mental health benefits. Now, if you'd like me just to expand on that, I think there are two directions here. One is when we're cooped up in the house for long periods of time, we're in danger of being far too sedentary. So basically we sit and lie around. We might binge watch videos and TV and things like that. And whilst I would be the first to say, look, please enjoy a good film at the end of the day, that's fine. I don't think binge watching is really a good idea in these circumstances. And we need to be breaking up our high levels of sedentary behavior. And we've already said on this podcast that staying in the house tends to increase your levels of sedentary behavior. So I think, first of all, sedentary behavior needs to be looked at very clearly because although the evidence on sedentary behavior and mental health is nowhere near as developed as it is for physical activity, which we'll talk about shortly, there is some evidence that, sitting around for long periods of time is not really that good for your mental health. So I think that's one area that people might want to think about. Yes, of course, they're going to sit down and they're going to enjoy a film or lie back and listen to some music on some headphones. That's great. But it needs to be done in moderation and needs to be broken up. That's the main thing, and not to binge seems to be the flavor of the month these days.
Yeah, and if we continue with these countries on a lockdown, so probably you can break up sedentary behavior quite easily as you would do it in any places if you have the will, if you have the routine. But doing actually exercise or cardio training that your heart rate would go up is actually really challenging, especially if it's a small apartment and many people there. So do you have any tips for them? How can they get like aerobic exercise? And I think that's also really important for mental health.
Yeah, no, that's absolutely right. And if they are in a small apartment and there are several people in there, it might be challenging. But if you go back to simple things like dance routines or some variation on circuit training, you can get some quite vigorous exercise in, hopefully in a relatively pleasurable way. I saw another YouTube video of this person in their apartment doing a whole range of exercises with wait for it, with toilet rolls. There's been a huge mass panic buying of toilet rolls, and so she did this, I think, out of a bit of in an amusing way. But she had all these different exercises where toilet rolls were involved, and they were great exercises. They were quite demanding exercises. If you did what she did, you would definitely be quite stressed out fitness wise and in a positive way. So there will be things to do. And I think, again, going back to the technology, there's lots of stuff online. There's lots of stuff you can watch and check out. And one hopes that they can make sensible decisions as to which ones are suitable for them.
Yeah, I think I need to find time to watch more YouTube as the best ideas are probably there.
Yeah. And just on that one, Ollie, I mean, this is where, some people are going to say, hang on a minute, didn't you just tell me I shouldn't be watching too much TV or something? Well, yes, but we're using YouTube as a positive way of getting some exercise. And, it may seem a little ironic that we're using what appears to be a technology, which often is sedentary, to get you to be active, but they can work in your favor.
Yeah, technology is just a platform. It depends what you use it for.
This podcast is sponsored by Fibion, a research device that has been shown to be valid in tracking sitting, standing, physical activity and energy expenditure. Furthermore, Fibion has been shown to be valid categorizing physical activity into light, moderate and vigorous intensity. In addition to scientific accuracy, Fibion provides automatically produced and easy-to-understand reports for research participants. Get scientific validation and learn more about Fibion at fibion.com/research.
And still, if you continue with this kind of, especially these worst affected areas, that how do you see the mental health? Probably all the medical resources are now used to treat the patients of coronavirus, so probably there's no medical counseling. If you develop mental problems, probably you are not prescribed, you don't get the meeting with the doctor. So how critically you see this situation from mental health point?
Yes, I think if people are struggling to get consultations, although, at least in Australia at the moment, if you want to talk to your GP, it will be a telephone consultation. So I'm not aware at the moment that if you had a mental health issue that you wouldn't be able to get some assistance. But your point is well taken, that obviously health professionals are going to be prioritizing the coronavirus. But I suspect that there are probably, because the mental health professionals are not necessarily going to be working on coronavirus in the medical sense, but they are going to be working on the mental health side, and they should still be available. I don't know. I'm perhaps now starting to get outside my domain of expertise, but I wouldn't be too concerned at this stage. One thing I would say is that, again, going back to physical activity, we know that physical activity can be highly beneficial for nearly everybody for mental health, and therefore, it comes back to trying to get into those routines and activities in the house.
Yeah, and if we go a little back, you mentioned that the breaking up the monotony and in the house, in the daily rhythms. How do you what's your advice is breaking up the monotony?
Yeah, so during normal times before we had the coronavirus, what would we have done to either entertain ourselves or entertain our families or do things that we enjoy in our spare time? Well, we would have done some hobbies. We might have also gone outside in some situations that we can no longer do. We might have listened to music. We might have watched a nice TV program. We might have cooked some food together. We would sit down and eat together. So there you go. I've just given you about 5 activities straight away that we could do. And I think if we make sure that we are aware of creating those breaks in our routine by doing those different activities, I think we would be mentally much, much better off. So as we're talking now, it's coming into early evening here in Australia. Well, what am I going to do for the rest of the evening if, for example, I was banned from going outside? Well, I might have a hobby I can do. I'm going to read my book. There might be something I can watch on the TV. I'm going to do some cooking. 4 activities straight away that might get us into a nice, breaks in monotony. And I guess it's similar, to people in retirement. What do people do in retirement? And a lot of people say that they get very busy in retirement, and they often wonder how they ever had the time to work. And they do this because they have created lots of things to do. Of course, some of these things they can't do so readily right now, but generally speaking, they have their hobbies, they have their garden, they have their cooking, they have their sports club, which, as you say, you can't do right now. Those are the kind of activities that I'm thinking of.
Yeah. And how do you see now the elderly and the risk groups? In many
Mm,
countries, they have been asked to self-isolate. They
mm,
cannot see anymore their grandchildren. They cannot help with those. Uh, it's different. Maybe many of them are not used to using the new technology. I'm not sure about that.
mm,
Some of them are very very good using it. How do you
mm,
see? Is there going to be a loneliness epidemic for the elderly, or what's happening?
mm. Yes, I think that is a risk. And I agree that while some of those people, and maybe actually a reasonably large number, will be able to use the technology, there'll be a sizable number who won't or will have difficulties. And if we were able, you know, it's a kind of catch-22 here. If we were able to show them how to do that rather better, as I say, it may be difficult because they're self-isolating, but that would be nice if we could do that, because the technology can break that social isolation. But I think, yes, we have a bit of a problem here. And, we need to find other ways of doing it. A telephone, of course, is perhaps the simplest. And regularly checking, regularly making sure that people have this social connectedness. I saw something recently where somebody put a note through somebody's door and said, "Look, if you need me, this is my number. If you want any groceries picked up, etc., etc." But I think this is
Mhm.
a genuine problem, and certainly grandparents not seeing grandchildren, if they live close by, is something they're going to have to adapt to. But it might be painful. Yeah.
Mm. And I think it's good to stress that this is probably a really good time to help your
Mm,
neighbors if they are in the risk groups. They probably
mm,
are allowed to go to buy the groceries, but I think
mm,
it's not a good idea to go
mm,
if you can avoid that you do the
mm,
shopping, you leave it on the door.
mm,
And please, I'm encouraging to help the
mm,
other the
mm.
risk groups.
Yeah. And I know it sounds sort of a bit trite that we would come back to exercise and physical activity, but older people also get a lot of benefit from this. And if they can encourage, maybe there are two of them. There's a couple in their apartment or in their house, but they are physically isolated for medical
Mm,
reasons. Hopefully, they can still do something, and they are encouraged by um, their family through the telephone, maybe to do something, and maybe that might break up the social isolation.
mm. Yeah, and if we go from elderly to children, there are more than 850 million people in kind of a new situation, or it's a early summer holiday for them. Mm, how do you see children in this case?
Mm. Yeah, I mean, it is different, of course, from older adults who might be suffering social isolation and anxiety and so, a different stage of their life. I think for the children, they're going to find it difficult not to do certain things that they really want to do, not to see some of their friends if that's the case,
Mm,
not to be able to go out and do things that they would otherwise do. And of course, it then backfires a bit on the parents, who then get stressed because we all need space, and if kids are around the parents the whole time, the parents get a bit stressed and the kids get stressed. So again, I think the same principles probably apply, like getting routines and getting things to break it up, finding a hobby. Let's get stuck into something that we enjoy, not binge watching 10 DVDs in a row, but maybe
mm.
watch one and then go and do something else, and so on. So yes, they'll be different, of course, but I think some underlying principles stay the same in terms of the psychology of finding better routines and a better way of existing while we have these special circumstances.
Yeah, and I have seen some people writing in social media tips when they are doing distance work, when the kids are at home, that they have, for example, they make a daily schedule that that you have certain activities. They make kind of different points in the house, that here you are drawing, here you are playing this, and so on. And they put the alarm, for example, every 45 minutes, that then the adult will give full attention, for example, for 15 minutes, and then back to work. How do you see this kind of
Yeah,
planning
excellent.
of the day? Is this
excellent, as long as it's not seen as sort of over planning. But I think that's really nice that, you know, people have a routine, they have variety. That's the other thing. Yeah, we've mentioned that monotony and variety, similar concepts. And yeah, I think that's a really excellent idea. And I guess for parents working from home, where they want to get work done, but equally they got kids in the house, that that break in the middle where they have a bit of time together would be excellent. And, you know, I'll come back to physical activity. They can do stuff together. They can, and everybody can lead. You know, you might have a family of 4. You can say, okay, we're going to do 5 minutes with each person leading something for everybody else, or put your bit of music on. We'll dance to your music. I mean, some of the parents may hate it, but they'll get on with it, and then vice versa. So I'm sure there are ways, but it's still going to be challenging.
Yeah, I see that.
Let's have a short break and hear a few words from our sponsor.
My name is Terje Gjøvåg. I'm associate professor at Oslo Metropolitan University. Currently, I'm using Fibion in a project where we investigate activities of daily life in people with lower limb amputation. My impression is that Fibion is easy to implement in this project. It's easy to use, and it's also simple to upload and analyze the data.
And then what you also mentioned is the anxiety from this situation. There's changes coming pretty much every day, and we don't have any idea how long, or we have some idea how long this will take, probably longer than what the governments are saying. But how do you see the anxiety and stress aspects of this situation?
Yes, I think there are issues of anxiety in 2 ways. There's one about the physical health, and there's one about financial issues, both for the economy generally and maybe for your own personal circumstances, your retirement fund, your business, whatever. And I think for, you know, anxiety, okay, we got to be careful we don't become too prescriptive again. But anxiety is often brought about where people feel either a lack of control, and, you know, in these situations, some things we maybe can have a little bit of control about, and other things we can't have control about at all. And I think we can't really control some aspects of the wider economy from our own individual point of view. And I think it's best to focus on things that we can control. And that might be around our physical health and the precautions that we take, and ways that we can make our day-to-day lives a little better. Again, physical activity might be one of them. It's not the only one. And we do know that physical activity can be a nice stress reliever, and it can be done in several different ways. For example, being physically active in a reasonably vigorous way, moderate to vigorous way. At the end of that, you know, a nice shower, and you change your clothes, and you generally feel better for that. You feel good. And in the same way, you could do something that involves a bit of exercise followed by some relaxation exercises, like yoga, where you do lie down and you relax at the end of a yoga session. And then when that's finished, you shower and change, and you do feel better. These are the acute or immediate effects of exercise on stress levels. You know, this is not going to solve the problems, but it makes you feel a little bit better and a little bit more relaxed, at least for a period of time. So again, I think exercise has some benefits for that.
And you said that kind of stick with the things that you can control and try not to worry too much of things that you cannot control. I think that's a good idea.
Yeah, it is a common adage in sport. You control what's controllable, and you don't try to control things that are outside of that. And easy to say, not always so easy to do. But hopefully it puts things in perspective. And I've spoken to lots of relatives recently, and quite a few of them are saying, "Look, there's not a lot we can do right now. Well, there are things we can do, obviously, to prevent ourselves from being at risk, but in the bigger scheme of things, we just have to follow the guidelines, get on with it, and hopefully get ourselves through the other end." And whilst I'm not playing down the seriousness of it, there isn't sometimes so much we can do. We have to just accept a few things and move on.
Yeah, I agree. And I think for me personally, I have felt this like kind of stressful from the point of view that it's really difficult to plan ahead. I was in next 6 months, I was supposed to be actually living 1 month in one country and 3 months in another country, and there was supposed to be a short winter holiday, and I think all of those have been cancelled now, and also all sport events I was supposed to take part have been cancelled, and I don't even know where I will be staying the next months. That's also, and there might be restrictions even to travel within Finland. So I think that's kind of stressful that you don't have any. You need to look the news every day to know that what you can do next week. So what's your take on this kind of future thinking that we have difficult time of planning to future?
Yeah, no, that's absolutely right. And some of the examples you've given relate to my situation as well, mainly in terms of travel. And you can get annoyed, you can get angry, and say, "Well, I need to travel." Well, no, you don't need to travel necessarily. It's highly desirable. In some cases, you might miss out on something that's very important to you, both from a family or a work point of view. All I can say is, we have to see the bigger picture, and we will hopefully be able to return to some normality in the future. So I think ruminating, having negative thoughts about these things is understandable, but it's something we ought to try to reduce, and we should think in the here and now. And try and get on with our day-to-day lives the best we can, and that might be helpful, I think.
And how do you see, like, many people have usually, or some people have goals? They have, for example, a marathon coming up or some kind of event, and I think those are probably cancelled for several months. So kind of the goals of exercise might have vanished. How do you see this affecting exercise?
That's a good point.
Routines, for example?
Yeah, that's a good point. And those runs, like marathons, half marathons, triathlons, or whatever, are very good goals for people to increase their physical activity. So if those have now been cancelled, it's the simple matter of trying to refocus your goals. Now, it may not be quite as motivating to set yourself a goal of regular exercise in the house as opposed to your marathon, but the principle is still there, that you should reset your goals. And this is common in goal setting anyway. Whether we reach a goal, we then reset it, or whether we fail to reach it and we reset it. And I think that's something we should definitely look towards. And one of the goals might be to say, well, let's learn some new exercises. Let me try and do something new. You might say, well, I'm going to learn Tai Chi, or I'm going to do these body weight exercises that I've never really enjoyed in the past. Let's see if I can get into them. Or I'm going to learn some dancing, which I can do in the house. So there are always different goals. They may not be quite what you desired, but I'm sure we could adapt them.
I think it's a good point. You kind of said that learning new exercises, but kind of learning skills, motor skills, in a way. And I think exercise might be limited in future thinking, that that maybe you have a goal of weight management, but it's not very long lived, or you either achieve or not, but it's not really motivating. And especially for younger people, preventing a disease in 30 years is probably not the best goal setting. So how do you see the goal setting between this kind of skill learning and then exercise in a more classic way?
You're absolutely right. I think exercise for disease prevention is, of course, appropriate, but it's not day-to-day motivating for a lot of people. I may well have said on a previous podcast that many, many years ago, we said that people exercise initially for reasons of health, but they will continue the exercise for reasons of enjoyment and well-being. And I think that still holds true. So I think the goals, okay, so if we come back to the current situation, I think the goals of our exercise should be, and they probably should be anyway, but the goals of our exercise should be to enjoy and to get some satisfaction and to get some feelings of well-being out of our exercise, and not just because it's good for us in the medical sense. Now, of course, it will be good for us in the medical sense. That's great. But I think we need to focus more on feelings of well-being, enjoyment, satisfaction, and all those kind of things as a reinforcing mechanism for our physical activity. I really do believe that.
Yeah, I agree. And then if we go a little bit different, like how do you see, for example, this situation for academics? Their work is usually quite independent. Do you see what kind of challenges you see in this situation now for the academics?
Yes, they will. So first of all, the issues that we've spoken about in terms of working from home and working more remotely, working through electronic forms of communication, they will apply very clearly to academics. I'm involved with meetings where our university are discussing and implementing all of this right now. And you could argue that academics are quite well placed to modify their work, but still continue with it. The obvious one being online teaching. Of course, it's not easy to suddenly take a face-to-face teaching course and make it online in a week. These things are not easy, but the principle is there that we can do most of our tasks online. And then you've got the typical situation that we've spoken about. If they're working from home, they've got to have a routine and so on and so forth. And they've got to be physically active and eat well and take proper rest periods and so on. So I think they're almost the classic working from home environment where they need to just be cognizant of all the different issues that we spoke about earlier, I think. But they're well placed to do all this. They're very well placed.
Yeah. It's been very, very interesting points. Is there any other themes you would like to bring to this discussion?
Well, the only thing I would say is that obviously the physical activity and mental health area is very broad. We've spoken quite a bit about anxiety. There might even be some depression issues, but these are all similar in the sense that physical activity should help these conditions, and we should see physical activity probably in two ways. One is what we call the acute effects or the immediate effects of exercise, where at the end of a dance routine that you've done with your kids and family, you just feel good. And whether it has a long-term effect, it's not really what you're thinking about. You just feel good in that moment, and that's great. The other one is the more physical activity you do over time, over weeks and months, then that's what we call the chronic or long-term effects of physical activity. And that should keep your depression levels down, your anxiety levels down, boost your self-esteem, and even boost your mind and cognitive functions. So, it's worth bearing in mind that physical activity is hugely important in mental health. And there are lots of different ways that we can do it, and people should be able to pick and choose and find the way that's most satisfying to them.
And I think it might seem that the physical activity is quite a minor thing in the scope of things in the world, but I think, like you said, it's a very important stress reliever, and also health in the long run. This will probably last for several months. So if people are very sedentary and don't do anything, it might cause mental health problems and other chronic conditions.
Yes, I actually saw something on social media today where somebody says, well, it's all well and good about promoting physical activity in the current situation, but surely we should be focusing on more important things. And I understand where they're coming from. And I think there's a bit of irritation amongst the physical activity field that a lot of people are trying to jump on this bandwagon and maybe even make money out of videos or exercise sessions done online or advice and so on. Although there's a lot of material out there that is you don't have to pay for, and it's just good material that encourages people to be physically active in the current situation. But I actually think it's not a trivial issue, as you suggested. I think it's extremely important. Life goes on, even though we're in difficult and changing circumstances. I mean, can you imagine that we would recommend that people just sit at home all day and do nothing? Well, of course not. We would always be recommending, a bit of variety and a bit of social discussion, different hobbies and different physical activities. And physical activity is good for the immune system. It's not going to cure coronavirus, but you want people in reasonable physical shape, both physically and mentally. So it may sound trivial, but it's certainly not, in my opinion. I think it's a really, really important issue for lots of different reasons, given our current situation.
And you said about people getting irritated that somebody is trying to make money out of the situation. I think there's a big distinction that, are you trying to make money or keep your livelihood? There will be a big economic crisis. So actually, it's good if people try to promote, for example, exercise through an app and make money in a way, actually keep the economy in better shape and maybe keep their job or livelihood. So I think...
Yeah, that's a very good point, Ollie. And in fact, I wouldn't like my earlier comments to be misconstrued. Totally agree with what you just said. If somebody said to me, look, my business in personal training is just... sinking fast, but I've got this app now that you can buy, I'd be very tempted to support it. So, it's a really great point that you made. Thanks for making it.
Yeah, and I think for us, it's what we can do is keep the social distancing, that we don't spread the disease, or is it physical distancing? But then we are not medical personnel who can actually help in the hospital. So we need to keep going with the things we each do.
Yeah, totally agree, 100%.
Yeah, so thank you a lot for taking time. It was a really interesting discussions, and I think there's really good tips for people to find routines to stay active in these difficult and challenging and changing times. Would you like to add something as the last things?
No, just thanks again. I've enjoyed the discussion. Yeah, we're in difficult times. Good luck to everybody, and stay active, and we'll get there hopefully. So thanks for the opportunity, Ollie. Really enjoyed it.
Yeah, fully my pleasure. Thank you.
This podcast is sponsored by Fibion. Get scientific validation and learn more about Fibion at fibion.com/research. The Physical Activity Researcher podcast has created an activity tracker purchase guide for researchers. Get your free copy from the link in the podcast description.
Thank you for listening to the Physical Activity Researcher podcast.